So we are recording. Aloha, mabuhay, good evening, magandang gabi po sa inyong lahat na impagasardam, maayong gabi sa inyong tanan. I'm yours truly, Dr. Mary Faye Aczon-Armstrong, founding president of the Asian American Pacific Islander Nurse Association of Nevada and professor in nursing at Roseman University of Health Sciences College of Nursing. Here we are again on a Monday night. Thank you for tuning in. Maraming salamat po sa inyong pakikinig sa aming programa, Healthy Mondays with Pino of Nevada. Well, if you haven't heard, July was designated as Minority Mental Health Awareness Month to bring awareness to the struggles that minority groups face regarding mental illness. Mental health conditions do not discriminate based on race, color, gender, or identity. Anyone can experience the challenges of mental illness regardless of their background. Mental health includes emotional, psychological, and social well-being, and it affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. And tonight is a special night because we have a special guest uh, coming in with many accolades and experiences to share some insights about minority mental health awareness. Well, allow me to introduce Reverend Dr. Denise Ogletree McGreen. She's a graduate of Walter Reed Army Institute of Nursing Bachelor of Science program at Syracuse University. And she is actually at Syracuse University is her Master's of Science in Nursing in Pediatric Nurse Practitioner track. And she has a doctorate from Jacksonville Theological Seminary. She is a retired Army nurse officer for over 27 years and with wide variety of nursing experience, educational and administrative experience. And for the past 6 years, she's the owner and educator consultant for McQueen and Associates. She's a healthcare provider for children and adolescents with behavioral and mental challenges for private facility. And without further ado, I would like to introduce Dr. Denise Ogletree McGreen. Wow, your name is as long as mine. So how would you like me to refer to you?
You can
Throughout.
just call me Denise.
Okay, okay, very day. So welcome to Healthy Mondays.
Thank
Um,
you so much. Happy to be here.
would you like to add more information of what I read so that our listeners will get to know you?
No, I think it's enough. I'm very honored and humbled, so thank you. I really
And
like to refer to myself as more of a person of service to help others. So I guess that
great.
title is a servant.
Yes,
That's what I get
it,
the most joy
yeah.
out of.
And it shows, you know, the preparation that we had in order to be where we are right now, right? So maybe we can
Yes.
you can share with us where your humble beginnings and also uh how did you get to where you are right now in terms of mental health?
Okay. When I was younger, I always liked helping people. Of course, I helped my mother. I remember after my baby brother was born. In fact, I was the one who helped with a note attached to my clothes. The grocery store wasn't far from where we lived. It was actually next door, and they were friends of ours. It was a small neighborhood grocery store, and my mom had just had my brother, and she couldn't go down the stairs, and my dad was overseas. So I had a note pinned to me. I think I was maybe 5 years old. And I
Oh,
got
wow.
the grocery items with the help of the couple who owned the store and brought them back to my mother. But I've always liked helping people. I spent the time I was 12 years old to the time I was probably 17. I worked as a volunteer candy striper for a facility for the elderly. But I still like to help people. And one of the best things about being a nurse is not we help people, we educate people. And I think even more imperative today because people just don't have either access or they don't have knowledge or they just genuinely don't know. And I think the COVID-19 pandemic really showed our gaps in our inadequacies and our inequalities. And I tell you that not just as a professional nurse, but even with the care of my husband who was very sick shortly before COVID really got into full swing and trying to get proper doctors, proper health care for him, and making sure we knew what was what. It was quite a challenge, and it was not a pleasant one. And I just thank God for knowledge, for wisdom, for patience, for perseverance. So that kind of gives you a little background in a nutshell of my whole thing is just to be an humble servant.
Oh, thank you, Denise, for sharing that part of your life. And yeah, you're right. COVID-19 had really made a lot of changes in our lives and the way we think of things.
Mhm.
But tonight's topic is about increasing awareness of minority mental health. I think we're looking at some of the unique struggles that the minority groups uh, experience regarding mental health. So with your, I know that you're a nurse practitioner, so maybe you can share us some storytelling about what you have encountered during your practice.
Okay. Well, we were talking about maybe looking at increasing awareness, and that's really, really important more now than ever. Um, as you said before, there's a lot of struggles and a lot of challenges, whether you're African American, Asian Pacific Islander, Latinx, Native American, LGBTQIA, and transgender, whatever it is. But I guess my concern is, why does it matter what the person's label is? We need to make sure that we inform people, help them. And also, I think one of the biggest things that I saw, and I still see periodically, is the microaggressions toward people that are different. And a
Yes.
lot of times, people in healthcare, especially if they're a majority race, they don't even realize it. They're not even aware of it. And
Mhm.
so that is a real struggle for people's mental health, because mental health is an imperative for everyone. You need to be able to be strong in your mind, comfortable in your mind, so you can make decisions about your life, so you can plan more appropriately. I think part of the reason we have some of the violence that we have all across the country and the nation is because people are not mentally well. They lacked they're they're not able to think clearly. They are overreactive. People get mad, like if you're sitting in a light and if you don't take off fast enough, they're honking their horns at you and the
Mhm.
light just change. And
Yeah.
it's almost like we've become a world that's it's all about me. We've become personal narcissists. And
Mhm.
so I think if we educate people that don't know, I think that makes them feel more valuable, and there's a mutual respect. And I think that's where we have to go, because that's our job as healthcare professionals, is mainly, it's not so much the hands-on sometimes, it's the education and doing it in a kind, nice manner and based on the person's culture. Make it applicable to them and don't make them feel like, oh, you have depression or you have bipolar disease, so there's something wrong with you. No, we need to show them love, courtesy, and respect and kindness.
Mhm. And also, I like it that you said that, that we need to be mindful about how we talk to them and how we treat them, and how someone who have depression, um, they need help. They need someone to really listen to them, active listening, and also
Yes.
not be judgmental. Because a lot of culture, like the Asian culture, they don't even acknowledge depression. We still have a ways to go for certain minority population to accept that it is a disease. Depression is a disease, but it's not a physical disease, but it's a mental disease. And we often
Yes.
forget that there's a difference in how each culture accept this mental illness, and or even not accept, because they would say,
Right.
oh, she is not depressed, she's just lazy, right? So I think,
Exactly.
yeah, this is lazy. So some of the things, so um I think some of the questions that I wanted to share, that the struggles, like what do you see in your patients that come in, that has, especially the younger population, some of the differences between childhood mental disorders versus adult mental disorders.
Well, when you look at children, for instance, with depression, most average adult is sad. They're kind of quiet, sad, introverted. Whereas children, the adolescents, I work with a lot of teenagers, average age is 12 to 17. But lately we're even getting the younger ones, which I'm happy because that's one of my passions. But
Mhm.
they're angry
Mm.
and they're vocal and they're irritable and they are sometimes so angry and irritable that they'll punch holes in the wall of the facilities or they'll try to talk back to whoever's in charge or authority. And I think when we talk about that, those are the other things we have to think about is, are we talking about Gen Z? Are we talking about
Mm.
millennials? Because how you approach them is so different. And a lot of times I find with my adolescents, I do a lot of listening. I just
Mm.
sit there and I listen. But even before I approach my patients, I come in early enough, if possible, so I can just sit in the nurse's station and observe them without saying anything. And I get from because think about it, mental health illness is invisible
Mhm.
for the most part. It's invisible. They can't see it, they can't touch it, and they don't always understand. And a lot of the teenagers that I work with come from broken homes, loveless homes. We recently had a young child under 5, and he was wandering in the trailer park barefoot, unfed, unclean, and his parents were both meth and crackheads. And so we don't normally take them that young, but he needed a place, and we agreed that we would take him. Of course, I'm happy to because that's peds is my area. And he was a very sweet child, very hyperactive, and he'd already been labeled. But that's the one thing I try not to do when I meet them. I want to find out myself over time what is going on. He was not autistic at all. He had been neglected, but he was able to say my name.
Mhm.
He knew what he wanted to eat. He was potty trained. So we have to remember, deal with clients on a one-to-one basis because no two teenagers are alike.
Are the
No
sign.
two
Yeah.
adults are alike. Because a lot of times when you talk with adults, they're very sad and it's very hard to gather and collect information. Whereas my teens, when I ask them, tell me what's going on, once they finally start, they blurt out what they're fed up with, and what they're angry about, what they're concerned about, what their fears are. So those are the things that I see with the teens. And, of course, when we're talking teens, you're not just dealing with the teen or the child, you're dealing with the parent, maybe the grandparent, you're dealing with the teachers. It is a very inclusive, we try to make it very inclusive with the teachers, the social workers, the psychiatrists, the psychologists, the nurse practitioner. We work in a team effort. The play therapists, we try to include a myriad uh, of things that we can do to help them out. And some of them, I will tell you, a lot of my patients are not a one-time visit. They're inpatient. Some of them are with us for months, and some of them I've been with them for 6 years. Some of them I've seen for 6 consecutive years.
Wow. Wow. I just wanted to share what I found in the literature, and maybe you can add to it that what some of the symptoms of childhood mental disorders, um, and they change over time, right? As we know, because the child
Mhm.
grows, and it may include difficulties with how child plays, learns, speaks, and acts, and even how the child handles their emotions. You were talking
Yes.
about their punching and they're angry. And the symptoms often start in early childhood, and although some disorders may develop during the teenage years. And so you were able to follow someone for 6 years, and you already kind of saw the development of where they are. And the diagnosis, from what the literature say, diagnosis often made in the school years and sometimes earlier. And
Yes.
there's a big question here. Can childhood mental disorders be treated?
That's a very good question, Dr. Maria. I'd like to kind of go back to what you said. One of the things that makes children or childhood mental health different from adult mental health is they are dealing with Erickson's, all those stages of growth and
Very
development,
exciting.
trust versus mistrust, autonomy versus shame and doubt. They're having to go through all those very imperative stages. And so it's imperative that we get a hold of it early because we want them to go through those stages in a healthy way. Whereas an adult, they've already gone through
We've
all
already
those
gone through
stages
that.
and maybe they're in that. It's not so difficult, but we've got teens that we've got to make sure that they have those. And of course, the other part is, which I stated before, is there's now, whereas you have an adult, they may come in by themselves or with a spouse, but with a child, you're talking about a family. A lot of my families are blended families. They may be adoptive children. It's really interesting that we were talking about this because I have one that I can think of, and she just recently found out that she's adopted and the person she's with has been her adopted mother, but she didn't know she had a biological mother. So now that's added on more things to deal with her, and she just turned 17, and I've been working with her since she was 11. It's been interesting to watch her. She'll go forward, then she'll step back, and she'll go sideways, and then she'll step back, and she goes forward. So it's almost like a zig. I feel like sometimes the kids are like a crossword puzzle, but you just got to listen to them and hear them to try to help them. But I really believe if we can, first of all, diagnose it early, get them the proper treatment, whether it's psychotherapy, medication, cognitive behavioral therapy, all of those work together in terms of a treatment plan to get them better. Because the key is, I think this is the most important thing, is to help them see that no, you have an illness that happens to be invisible. It's not like you have diabetes. So you're worried how your peers think about you. You don't want anyone to call you crazy or think you're
Exactly.
crazy. But
Mhm.
there's a title once we find it. And it's okay to claim ownership to that, but it's also okay to get help so that you can get better.
Yeah, it says in here, I can only go by the literature because I'm not a pediatric nurse and I'm not a maternal newborn nurse. So I bow down to you guys,
Oh, you're
because just
just
like you
sweet.
said, you're not only working with the children, you're working with the whole family unit. So they did say in the literature, just like you said, childhood mental disorders can be treated and managed. That there are many treatment options based on the best and most current medical evidence. So parents and doctors should work closely with everyone involved in the child's treatment. The teachers, you
Absolutely.
mentioned, the teachers, the coaches, the therapists, and other family members.
Absolutely.
Also, it does talk about taking advantage of all the resources available to help the parents, the health professionals, and educators guide a child towards success. I don't know, I have a frog in my throat right now. So I'm going to let you share more information so our listeners out there would feel that it's based on reality, that it is really happening. I think we're seeing more and more young children coming up and needing mental health providers to get involved, because I think the resiliency of our younger generation is not as resilient as when we were growing up, because we were left on our own. We were able to go out on the street and come back at 6 p.m. and we will just be playing on the street and picking flowers and cutting flowers and making like cooking, and now it's not possible. So I think um, our children now is not as resilient as we were before. So
Agree.
please go ahead and add to that what I was
Well,
saying.
I do agree. It is a different world than when we grew up. I think a lot of times people are living in fear. It's like they're afraid to go out, they're afraid to go this place. Again, I'll talk about in terms of the COVID-19 pandemic, people got used to being home or wherever they were. And one of the things you mentioned earlier is so true because we have it also in the African American culture. Mental health, of course, is that invisible disease, and most people just want to sweep it aside, put it in a closet, and it's not talked about. And so I think once we start, like we're doing now, we have to start dialoguing about it, talking about it, and not putting uh, a
Shame.
negative face on it. It's so we want, especially because I know a lot of African American families when I was growing up, that was a no-no. You didn't talk about that cousin who had that strange behavior. You just kind of said, oh, they're just different, or you just kind of hid them in a closet. And I think sometimes still people want to hide because, well, think about it. Most everybody wants to be accepted. They want to be normal like everybody else. And so it's one of the things that we see with children and teenagers is they don't want to be different. Just think about a child that's a diabetic and they don't want other people to know they're diabetic. They don't want anybody to know they're worried that they have to take insulin or that they can't eat a Big Mac and have a big shake with it at the same time because of the sugar. So, if we can teach them to be comfortable with that, we've got to find ways to help people be comfortable with the fact that they have an invisible disorder. Doesn't mean that I always tell my kids, doesn't mean that there's something wrong with you. In fact, you are very unique and it makes you even more extraordinary and wonderful. So we just have to find ways so that you can cope with it, so that you can be in control of your responses. Like hitting walls. If you get angry about something, that's not always the best thing because you hurt your hand or you break your hand. We have to send out for x-rays. We want them to be able to have appropriate coping mechanisms.
And then on the other hand, I know that the pediatric population is your love, but I also wanted to kind of touch upon the adult mental health.
Yes.
Yes, in the literature, mental illness is a condition that affects. We already know it affects the person's thinking, feeling, and or mood. But some conditions may also affect someone's ability to relate to others, because of the way their thinking is different, and also their functioning every day is different. It fluctuates. Like sometimes they're okay, sometimes they're not, and so it's hard for them to keep friends because their friends would say, "Oh, you're." They don't want to deal with this fluctuation of their emotions.
Right.
And then also each person, they will have different experiences, even with people with the same diagnosis. So it also talks about, maybe you can share with our listeners out there about the signs and symptoms of mental illness. And we already know each person is different, but what would be the most common signs of mental illness in adults and adolescents that we can include?
Well, when we talk about adults, a lot of times, sometimes you may have a friend and you're wondering why they're always sad. They have those moods. Maybe they're real sad sometimes, and it's more than, maybe it's a close friend and they're sad. They have a persistent sadness that's more than 2 weeks.
Mm-hmm.
Maybe you have a friend they're having a high moment, the high and low, like bipolar. It's like they want to go on a shopping spree and buy everything, knowing that if they use that money, they won't be able to pay their house payment.
Mm-hmm.
So, those subtle little things that you notice. Maybe the other thing is, and I've seen this with some of the adults because they may have done it when they were children, but you'll notice maybe an adult that kind of pulls at their arms or their wrists, and then you happen to notice all these marks. They were cutters,
Mm-hmm.
and they've been cutting. So when they go through a stressful time, they cut. Uh, Maybe they are over talkative or too quiet, or maybe sometimes you have a friend that says, oh, life is so hard as an adult. And they say, maybe I should just go ahead and disappear from the earth or do away with myself. That should cause us to kind of perk up and go, hey,
Something's
talk
going
to me.
on.
What's going on?
Yeah.
What can I do to help you? Do you have something to help you, or do you have a doctor's appointment? Can I go with you? Can I help you? You don't want to push, but you do want to keep kind of investigating so you can help them. Some people get to the point that they just have totally out of control in terms of their behavior. And that's something different for them, or at least for you, maybe that's the first time you've seen it. You should start to suspect that maybe they have some type of depression, anxiety, maybe they have bipolar disorder. So, and like I said, adults, sometimes they won't tell you, but adults who have some problems for a while, be open and honest about what's going on with you. And they'll tell you, I need to go to therapist. And the biggest thing I see with a lot of adults, the reason they start having problems, they stop taking their medication.
Yes. And
it could be, I feel fine. I don't need my medicine.
Because they feel fine because the medication. yeah, the medication is
Mhm.
working, and could be as simple as changes in their sleeping habits. They're
Yes,
tired, they have low energy, also
right.
changes even in eating habits. Maybe
Yes,
they're increased hunger and they keep eating, or maybe they
yes,
don't want to eat. So basic things like that, that our listeners, if you know someone, I think this is how we can increase awareness about
yes,
minority mental health. And I think that's we have to be cognizant that each culture have different ways of dealing with it.
hmm,
So yeah, I'm looking at what other things that we can share with our listeners out there. I think that it also talks about that many people diagnosed with mental illness achieve strength and recovery through participating in individual or group treatment, and that there are many different treatment options. So maybe you can share with us what kind of, if you are offering any um, individual or group treatment, what's the advantages and disadvantages of the individual versus group treatment.
I think for the most part, most patients benefit from both individual treatment and group treatment, because one of the key things that's really important for patients who have mental health disorders, they tend to want to isolate. And
Mhm.
that's what gets them in trouble, because then once they isolate, if they're a patient that maybe has auditory or visual hallucinations, when they're by themselves, that's when they become more prevalent, especially if they've stopped taking their medicine. So that group therapy helps them to be inclusive. Again, I think we're trying to make sure that have people feel included. And I think it helps when there are providers who look like them, or if not look like them, understand their culture, understand their history. And if they don't, they're willing, because sometimes you might, if you don't know the culture, you can even ask them. What's nice, I've noticed in some of the group therapies is for the adults, is that we have people that look like them. We have
Mhm.
people that are different from them, and we have a diverse community in that group therapy. And then sometimes we may have one or two therapists that look like the people in the group. Because a lot of times that helps, because there's nothing worse, I think, and I've seen this, is to have a client that's a minority, and you have someone is that traditional person, kind of uptight therapist that doesn't get them.
Mhm.
Kids call it like a Karen, as they call it. They
Mhm.
don't understand them. And so they
Yeah.
have those, they don't mean to, but they're kind of that stiff upper lip, and they're showing those signs of, because really what's happening with that provider is they're uncomfortable. And one of the things we talk about in group when we do therapy is, before we do any therapy with the children or the adults, is if you're not comfortable with something, we need to help train you and get you comfortable before you work with those clients,
Yes.
because it's not fair. Because we've had clients that are so close to being successful, and then they get someone they're not comfortable with, and they go
And you
right back
close
to
up.
where they were. So we've got to make sure, as providers, whether in a community based, faith based, whatever it is, we've got to get everybody on the same sheet of music, so that we're inclusive, loving, and kind. And it doesn't mean you have to hug on them all the time, because a lot of times you don't want, but you want to acknowledge them when they say something, show them that you're interested, look at them. Of course,
Mhm.
sometimes with some clients with mental health disorders, they don't like you to stare at them. So
Mhm.
again, it goes back to the culture. And so you need to be aware. And so we all help. What I love is when we, as especially as nurse practitioners, we help each other, because like the Philippine Nurses Association, the Black Nurses Association, the Latinx, when we all come together and come up with ways to help each other. Like if I have a client that's Latinx and I'm not so sure about something, I'm going to check with one of my colleagues or someone to say, what do I need to be doing? What do I need to think about when I'm working with that client? So I think we need to make sure that we're kind, inclusive, and patient at all
Yes.
times.
Yes. Patience is like, if they are there in your care for a reason. And I think
Hmm.
one of the things that we cannot build rapport with the children if we are not willing to give them the time to listen
Yes.
and pay attention to them. And
Hmm.
how why would I mean why would you open up with someone who is not willing to listen to you, right? So I think that's
Exactly.
one of the things that we need to to remember, and understanding the culture also, what's
Mhm.
accepted and what's not.
Right.
Because just knowing about the culture is not enough. You have to understand
Mhm.
why things are being done. And maybe this example I'm going to share is not related to mental health, but in a way it is. You know, when I was still a nurse here in Hawaii. So we have a Samoan lady who's about to give birth, and she refused to stay on the bed. She was squatting already on the floor. And then
Mhm.
later on, I found out that in Samoa, in the traditional, that's how they give birth. They squat on the ground.
Yes.
And so we accommodated the Samoan patient, and we patted the floor. So then, because she just refused to be on the bed, that's not how they deliver the baby. They just, you know, on the ground, they just, someone probably catch the baby, or however they, you know, however they protect the baby. And so enforcing the American way is not going to help the patient. So find out, how are we going to be able to, you know, to allow our clients or patients to open up, so then we can help them, right? So,
So true.
uh,
That is
so,
beautiful, but so true.
so I'm looking at our time. Time flies when we're having fun. I think my cue, Denise. So I guess, you know, before we close our conversation about minority mental health, do you have any words of wisdom to our listeners out there, either the family of the patient's children or adults or teenagers who may be undergoing any type of mental illness?
Well, I would say probably for the patient, whether they're children or adults, be patient with yourself. Be honest with yourself and find someone. There's got to be someone that you can talk to and say, I need help. I need help. And don't give up. And then for the families, the caretakers, and what have you, I think we need to learn, make sure that we are good listeners, not only with our ears, but with our body language. Don't
Mm.
try to rush them. Don't try to put words in their mouth, and be there to help them find the resources. Maybe you can, I think as nurses all the time, we're connectors. So
Mm-hmm.
you be that connector. Find out what they need. What is the, and help them. Don't tell them. Help them find out what the priority thing is for them. And then be supportive. Like when they're on medications and what have you, be supportive with them with their medication. Be supportive with them with their therapies and what have you. Because it takes time to get help and it takes time to recover and heal. And the thing is, most mental health does not go away. You learn to live with it, you learn to function with it, which helps you get better because you can learn to live with it. And it doesn't mean that you're going to be 100% perfect, but you're going to be the best person you can be for you. And we as professionals and providers and help, we just have to be tolerant, be patient, loving, show kindness, and don't give up. Never give up on your patients.
Thank you so much, Denise. I like it that you call it the invisible uh, illness, right? Is that how you will call it? The invisible illness. I
Yes.
like that. It's true.
Mhm.
So, well, thank you again, Denise, for sharing with us your insights and sharing your expertise. For last minute, you know, thank you so much. And I also wanted to thank PHLB Radio, Johan and Flora, for allowing us to have this platform to help our listeners out there to increase their awareness about minority mental health. And so, with that, thank you for tuning in with us. And remember, every Monday is a healthy Monday. Aloha.
Mahalo.
Mahalo. Yes.